I've been a generalist for my entire practice because I've been in locations that required that. Been solo at one point, and so you're taking all comers and you're treating all their different conditions. As time goes on, though, you subspecialize, and I grew up in an orthopedic program that had a lot of hand specialty, and so when I first came to town, people said, "Oh, you do hand," and it just naturally I kept doing it and do a lot of it still. There are certain procedures that people really are unaware of, like the most common part of arthritis in the hand is the basal thumb joint, and these mid-50s females come in with this horrible pain and they're not sure what to do with it, and they're very surprised that there is something definitive to do with it that works really well. The other thing that's happened over time is just kind of gravitated towards more and more total joints, and at this point that is a big chunk of what I'm doing, and I think probably it's going to be more and more of that in the future, with more of a subspecialization. The technology for that keeps improving, the longevity of the implants, just the whole procedure to go through, it's getting better, and the results are spectacular. It's about 400 to 500 is probably a pretty average number of surgical procedures a year. It's going to be 150, 200 of those at least are total knees. And if you add that all up, it's something like 10 or 12,000 in the career so far. The hand is another thing that people have problems with universally. We're in a very hand-intensive society. I mean, we're using our hands all day long for all this different stuff, and especially with manufacturing and construction and all of those really repetitive hand-intensive activities, we see things wear out, we see injuries, carpal tunnel syndrome, I think everybody's heard about. Pretty common thing as people get older, and depending upon job, that's totally curable. I mean, it's just simply, it goes away. You get the pressure off the nerve, no longer a problem. Trigger fingers is another thing that happens frequently. People get these fingers that catch and pop, and it's 8 minutes to release this little band, and that's gone. Frequent thing is the arthritis at the base of the thumb. Arthritis throughout the hand in general, but the base of the thumb seems to be the one that really drives people crazy, especially 50-year-old ladies. That 50 to 60 range seems to be the worst. And although a little more difficult to recover from, great results. The pain is absolutely gone. They get back good function. They're happy they had things done. And there's a lot of other things with hand and wrist and various tendinitis or needing other joint implants. It's common, and it makes a real difference when they get it taken care of.